Hello, everyone. Welcome back to Dr. Ken's ASMR. Welcome back to the channel, and I hope you guys are all doing very well. I hope you're having a wonderful day and a wonderful night. Today, we'll be finishing up our patient interview. This series has gone on to this third episode, and I want to thank you for supporting this channel. Now, without further ado, let us begin. I believe last time we left off at the nose, so let us start at this part. So you want to ask your patient on the review of systems about their nose. Ask about the stuffiness. Ask if there is rhinorrhea, which is the runny nose. Ask if they are having any postnasal drips. Ask them about any itching, any kind of dryness, bleeding, any kind of sinus pain, or a reduced or even an enhanced sense of smell. Now, moving down from the nose, we go to the mouth and the throat. So you want to ask your patient about any issues with their teeth, with their gums, if it hurts, if it's bleeding, the frequency of visiting a dentist, any sores on the tongue, mouth, or lips, any kind of fever blisters, any kind of cold sores, canker sores, thrush, tonsillitis, if they have frequent sore throats, any hoarseness in their voice, any changes in their voice. And you want to ask about their chest, moving down from the mouth and the throat. You want to ask if they have any coughing, any sputum, including the color, the quantity, any dyspnea, any shortness of breath, chest pain, if there's any hemoptysis, which is coughing up blood. Ask them if there's any wheezing, any dyspnea on exertion, any orthopnea, which is shortness of breath when lying down. When was their last chest x-ray? And again, right on the chest, if they're female, you want to ask about the breast, if there are any lumps, any kind of pain, any discomfort, any tenderness. Do they do any self-examinations? When was the last time they had a clinical exam, a mammography? And also, you want to ask about what's behind the chest, about their heart. So ask if there's any kind of cyanosis, if they have experienced any syncope, any chest pain, chest discomfort, if they have any palpitations, any edema, and also when their last EKG was, okay? Again, moving down, we go to the GI, the gastrointestinal system. We want to ask if there's any abdominal pain, if there's any anorexia, any changes in their appetite, any nausea and vomiting, if they have any diarrhea or constipation, any changes in their bowel habits, and also what does their excrements look like, their stool and their urine. But we'll move on to that later. So for the GI, ask if there's any dysphagia, any pain, any difficulty swallowing, eating, any odynophagia, any heartburn or regurgitation, acid reflux, and of course if they are vomiting blood, which is hematemesis, then you want to be sure to mark that down on your notes. Ask them if they have any indigestion, bloating, gas, etc. Okay, and moving on, going further down, we want to ask about the genital urinary system, not gastro. Gastrointestinal is GI. Genital urinary is GU. Those are two different things. So for the genital urinary system, you want to ask about the change in the frequency, in the volume of the urine, if there's any polyuria, if they get up at night, which is nocturia, if there's any pain or burning upon urination, if there's any flank pain, is their color changing, maybe it's hematuria, if there is urgency, straining, incontinence, or perhaps there's a change in odor, which we have to suspect genital discharges, any sores, or any other issues that they may have that is related with their genitals. Moving on to the whole body, we look at the musculoskeletal system, and this is fairly basic. You just want to ask about muscle pain, tenderness, any backache, any joint pain, any swelling, tenderness, or perhaps they're feeling some heat, maybe it's inflamed. We do want to know about that. And also want to ask about their blood. Do they get bruises easily? Do they bleed easily? Do they have bleeding gums? Any blood clots? Any transfusions, etc., etc.? And also, what do the blood go in? Where is all the blood? We want to ask about their vascular system. So, do they have any color changes in their fingers and toes? Especially during cold temperatures like it is now. I hope you guys are all staying warm and not getting too cold in this brutal winter. We don't need any more sad things in life in 2021. Please, let's just all have a good year. I hope, I pray and pray. And I hope that we don't have too brutal a winter and the good weather comes soon. But anyway, I digress. About the vascular system, you want to make sure that during the cold temperatures, your patient's fingers and toes do not have any abnormal color changes, such as cyanosis, okay? And you want to ask about leg cramping, any claudication, any edema, loss of hair, etc., etc. Oh, and of course, ulcers and varicose veins. Now, about the neurological portion, you want to ask about dizziness, any headaches, any blackouts or fainting, which is syncope, any kind of seizures, weakness, paralysis, numbness, tingling, paresthesia, any kind of burning sensations, trembling, pain when they're moving. Is it affecting their ability to walk, their steadiness, their sense of balance? Are they having memory loss? Are they having difficulty concentrating? Any kind of behavioral changes, etc., etc. Also, now next on the list, you want to ask about their endocrine. So, especially if they present with a very suspicious set of presentations, ask about their thyroid. Is there any goiter? Is there a recent heat or cold intolerance? Do they have excessive sweating, excessive thirst, hunger, polyuria, changes in their hair, changes in their skin, any changes in their body parts? If they're female, ask for changes in their breast. And also, of course, changes to the size of their body, or changes in the size of the clothes that they're using, they're wearing, their hat, their glove, their shoes. You might suspect something wrong with the endocrine system. And last but not least, you do want to ask about the psychiatric health of your patient. First, you want to know if they have undergone any treatment or diagnosis for any psychiatric illnesses, issues, any emotional distresses in the past. Do they get nervous, anxious easily? How's their mood been recently? Any personality changes? Any insomnia? And of course, any hallucinations or delusions. All right, everyone. Thank you so much for following me through this journey of a quick overview of the patient interview process. And these are, of course, just very basic and a general look at the patient interview. Once you go into the room, or once the patient comes into your room, into your office, anything can happen, and you want to be wary of different situations. You want to pay attention, pay attention, pay attention. It's important, so I'm saying it thrice. I do want you all to really, really focus on the patient and what he or she might be going through, what they might have been through. If you have the time, and I know time is always against us, but if you have the time, please pay attention to who they are, what they do, and their overall state, and try to lock in what you think might be the issue by asking them all the correct questions. Okay? I wish you the best of luck, and I wish you a good night. Thank you so much, and I'll see you guys next time. Bye-bye.